in patient education and teaching my patients self-management strategies. I help them to understand their diagnosis, their symptoms, and how they interact with each other. So, if you're watching me on Facebook, please go over to my YouTube channel and subscribe. If you like what you're watching, then press that bell button so you are notified the next time I am doing a live. Alrighty. So, if you're watching me on the live, say hello, give me a heart or a wave so I know you're here. And if you're on the replay, just comment #replay. Alrighty, so the topic for today is the symptoms of cervical spondylosis. Okay, just give me a second. We're going live on IG as well. Oh, hello. So today's topic is the symptoms of cervical spondylosis. So I'm doing this as a series on a neck pain. So you might have had neck pain, gone to your doctor, they've diagnosed you and said you've got cervical spondylosis. Now you're wondering, what on earth happened here? How did I get cervical spondylosis? Right? In our previous video, we explored what is cervical spondylosis. So you can go back and watch that if you haven't watched it already. So what are the symptoms of cervical spondylosis? So firstly, you have neck pain, you have stiffness, you might have a sore, achy feeling around your neck area, right? So why this happens is, so basically we're going to talk about symptoms and why the symptoms happen, right? So you understand them well. And then we might also talk about how these symptoms interact with each other or lead to other manifestations in the body. All right, so firstly is your neck pain or stiffness or soreness in the neck. So the reason you get this is because there's a lack of movement that happens because of the development of cervical spondylosis, be it your disc or your stenosis issues. Because of that, because of the reasons we explored in the previous video, you might have this neck pain or stiffness, right? So you might even hear a clicking sound or a grinding sound in the neck. Now, when you hear that click, 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 or that little click, you know how when you snap your fingers together? So that sort of a click can also be heard in the neck. So why that happens is basically there's osteophytes due to the degeneration in the spine. Degeneration is nothing but the wear and tear process that happens in our body, right? I'm sorry if there's a background noise here. There's some construction going on around my house. Okay, so going back. So we've got some clicking or grinding sounds in the neck because of the osteophytes. They're like the thorny projections that form on the joint surfaces. So the next time the joint surfaces are rubbing against each other, the osteophytes are going to cause those clicks in the joint, right? So, oops, my camera just went off running. Just knocked my laptop off. Okay, going back. Sorry, too many distractions. No more. So yes, so these joint surfaces will rub at each other and they will produce a grinding or a clicking sound. There can also be weakness in your upper limbs. So basically anything from your shoulder, forearms to your fingers, to your fingertips. You might feel when I carry a glass of water, I'm not able to lift it up as well on, say, my right side, if my right is affected, as compared to my left side. So you might feel a little weaker, or if, say, you are carrying something, some objects with both the hands, you might feel I'm not able to balance it so well with my right hand because I feel a little weaker, or things might slip out of your grip, right? So on the affected side. So why this happens is basically the nerves that are affected in the neck. These nerves, when they supply a certain area, for example, my lower cervical nerves will be supplying my hand. So when these nerves are affected, I will feel the weakness in my hands, right? So that lack of strength in the grip strength will be felt in my hands. So another thing you can have is tingling numbness. So you feel like there's a buzzing going on around in your upper limbs, right? Or you might feel achy pain down your arm, or you might feel a burning sensation as well. So depending on which part of the nerve is affected, because the nerves have different fibers that carry different sensations to our brain. So for example, if a certain type of fiber is affected, it might give me tingling numbness, but the same condition in another person person, another part of the nerve is affected, another set of fibers is affected, and they might get just burning pain down the arm. So it can be very variable from person to person, right, depending on which part of the nerve is affected. So these two things, the weakness and the tingling, numbness, burning sensation, etc., all the nervy symptoms can go down your shoulders, down into your fingertips, or this tingling, numbness, burning, etc., can also go down into your shoulders here and down into your upper back and your shoulder blade area, right? So you can get pain or discomfort in your shoulder blade because the origin is in the cervical spine. So because our body doesn't work in isolation, it's always working in conjunction with each other. So you can get affected in one part because of the others, affected in the shoulder blades because of the problem in the neck. Okay, so another example of this is with cervical spondylosis. If your upper cervical spine is affected, you can also get cervical headaches. Now, your cervical spine is made up of 7 vertebrae. So the first 3 to 4 vertebrae, like C1 till C4, we call them like C1 is first cervical. So C1 to C4 is the upper to mid cervical spine. So if these are affected, you can get cervical headache. So basically, you'll feel like a tightness coming along your head here, and then the pain will sort of creep up the head like this, and then you might even get it around the temples, this area, and into or behind your eyes. So that is a cervical headache. All right. So this can be accompanied with nausea. So the problem is in the neck, but the manifestation is in the head with the headache coming up here. All right. Another thing, oh yes, of course, you will have muscle spasm as well. So muscle spasm will be protective, and it could also be due to a bad posture. So for example, if I am always say if I'm reading a book, so, or I'm looking at my phone and I'm always leaning forwards like this, so you see how my neck is always stretched here and these muscles are always shortened here, right? So if you have postural deviations, or if you don't have your proper postural alignment, that can also lead to cervical spondylosis. But however, that can also lead to symptoms like a cervical headache, and it can also lead to forward head posture. So you're like poking your head out like this. So these are a few things that you might notice if you have cervical spondylosis. Now, what can you do about cervical spondylosis? If you go to the doctor, they'll give you the painkillers. If you have nerve issues like the tingling, numbness, and weakness we spoke about, then the doctor might give you nerve relaxants as well. Sometimes if the condition's really chronic, they can give you they can suggest injections as well, which do work and they have their own place. However, with physiotherapy, physiotherapists will do like an assessment for you and then give you treatment in terms of stretching exercises. For, you remember when we're talking about the head being here, if I'm always looking at my phone, so I will give you stretching exercises for these muscles and more strengthening for the upper back and neck muscles as well, right? So because if you stretch a muscle over a prolonged period of time, it tends to get weak, so you need to strengthen it, right? So what you can do at home is hot packs if you have muscle spasm. If you have a lot of soreness, inflammation at the end of the day, you feel really heavy and sore around your neck or arm area, you can use a cold pack. You can correct your posture. That's a topic for another day, so we can look at it in details later. But yes, you can correct your posture. And also, yes, I did do video. It is present in my YouTube. I'll put it up on my IGTV as well. It is a video where I show you simple exercises and precautions that you can, precautions in terms of very simple movements that you can do throughout the day, so that you don't have so much neck pain. So it's basically called simple tips to, or easy tips for pain relief from cervical spondylosis. That's the title of the video. Alrighty, so that was it about cervical spondylosis. So I hope you found this useful. If you like what I'm talking about, do pop into my Facebook group. I'll leave a description. I'll leave a link in the description below. And do let me know if you have any questions. I'll be happy to help you. Alrighty, guys, I'll see you when I see you next. Okay, bye.